We are going to talk about the triangles of the neck. This is the posterior triangle. Okay, posterior triangle is bounded in front by posterior border of sternocleidomastoid and posteriorly by the anterior border of trapezius. And again it is divided into two more triangles. One above one is known as the occipital triangle, below one is known as the supraclavicular triangle. This is the muscle which divides. This is called the inferior belly of omohyoid. So this is small string that you can see. So this divides it into occipital triangle and supraclavicular triangle. So contents we'll discuss later. We will only talk about the boundaries now. And here you can see the two heads of the sternocleidomastoid taking origin from the clavicle as well as the manubrium part of the sternum. Okay, so this is sternocleidomastoid. So now here in front of the sternocleidomastoid, whatever area you can see, that is all anterior triangle. Anterior triangle is again subdivided into four more triangles. So here you can see the platysma. So if you reflect this platysma, or you can just remove this off, you should be able to see two important triangles just below the chin. One is known as the submental triangle here, which is bounded by two anterior belly of digastric muscles, and you can see the floor is formed by the mylohyoid muscle. So it is a nice bipinnate muscle. You can see this is the midline raphe, and this is two anterior belly. This is the chin. This is the hyoid bone. So it looks like this. Okay, triangle. So this is submental triangle. This is the mental. Submental is below this region. So this is submental triangle. Now coming to this region, you can see there is anterior belly of digastric, and lift this gland. This is known as the posterior belly of digastric. Okay, you can see this muscle, that is a posterior belly of digastric. Anterior belly is supplied by mandibular nerve. Posterior belly is supplied by branch of facial nerve. So both have got different nerve supply. Okay, this region which is bounded by anterior belly, posterior belly and base of the mandible is known as submandibular triangle or digastric triangle. The important content is this one. What is this? Submandibular salivary gland that you can see, and you can also see the facial artery and the vein. So here you can see the vein is here and the artery is the one which is tortuous. Okay, so both you can see here, which is winding in front of the masseter muscle and going towards the structures that to supply in the face. So it gives many branches in that. Mostly the anterior branches it gives. Posterior branches are all unnamed. Okay, so that is about the facial artery. And here you can very clearly see the submandibular gland which is present in the submandibular triangle. And what you can see is all these are facial muscles. You can see orbicularis oris. You can see this is depressor anguli oris. Okay, because near the angle it is. And here you can see fibers of buccinator. All these are the fibers of buccinator. And if you trace it little more, on this side we can see the parotid gland. We can see the other structures. We can see the parotid duct piercing the buccinator. We can see the facial artery and the vein. We can see this is the artery, this is the vein, and this is about the structures here. And this is the submental triangle and submandibular triangle. And here these are the midline structures. In the midline structures you can see the mandible, you can see the hyoid bone. You should be able to palpate the thyroid cartilage, then cricoid cartilage. We need to do further dissection to show the contents of the and boundaries of the muscular triangle and the carotid triangle. Carotid, already you can see the carotid vessels here, but I need to find the boundaries. What is the boundaries of the carotid triangle? Above by the posterior belly of digastric, and on one side it is sternocleidomastoid and the other side it is superior belly of omohyoid. So this is the content. So you can see the carotid vessels, you can see, but we need to do little bit of clearing this area.